Good morning. Welcome to Hoag's Roadmap to Medicare and Supplement Plans. My name is Patty Contreras. We are live from Newport Beach, Hoag Medical Center. I really appreciate everyone who's joining us. We're going to cover a lot of good information. Please kindly, as you see the presentation, jot down your questions in the chat box. And at the end of the presentation, we are going to address every question that we get in the chat box. So with that, we will start. Just to give you a little bit of my background, I've been in the industry for 30 years. I do have experience in corporate banking, commercial real estate owned, insurance in the financial industry. I've been independently owned in a boutique style agency for 15 years. I am a UCLA alum, class of 91. I do have a diverse background, extensive knowledge in Social Security, long-term care, disability, Medicare planning, and everything that impacts income. I'm also a wealth planner. I'm an expert in health insurance and save money strategies. I do work under a team environment with other business leaders that bring an additional 20 years experience and knowledge within the U.S. I'm also licensed in 11 other states: Arkansas, Arizona, California, Florida, Maryland, Michigan, Nevada, Oregon, South Carolina, Texas, and the beautiful state of Washington. And with that, we'll start. My goal today is primarily to get to know each one of you that are joining us in this live webinar, essentially to become your advocate and provide good information and review options as I meet with you one-on-one. I love to educate folks and to make sure that we are looking at plans that are a good fit for you. Always important to begin the conversation of what is best for you. And the way I do that, we schedule a one-on-one, either virtually or in person. And lastly, I always encourage referrals. So if I'm not able to help you, I'm sure you have friends and loved ones that are going to be aging in, would love to be able to help them as well. Let's talk about first the parts of Medicare. So with that, Part A is coverage for the hospital care if you're hospitalized, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. For Part B, physician services, everything under the ancillary, outpatient hospital services, ambulance, mental health, labs, DME, durable medical equipment, everything that's under physical, occupational, and speech language therapy, and some preventative care as well. Please take note that Medicare only covers 80%. So with that in mind, it's very important to fill in the gaps in Medicare. Under Part A, inpatient hospitalization, for those folks that only retain original Medicare and choose not to add either an Advantage plan or a supplemental, they are going to be relegated to this $1,484 deductible the first to 60 days. From day 61 to 90, $371 per day, $742 from day 91 to 150, and obviously after day 51, 151 and up, you would have no coverage. So it's really important to understand that original Medicare is great, but you want to make sure that we fill in those gaps so that you're not relegated and subject to these out-of-pocket costs. Under nursing, the first 20 days are zero copay, but from day 21 to 100, it's $185.50 per day. And you have no coverage beyond 101 days. So it's very important. Medicare does not cover long-term care. It's short-term care. So if you don't have gap coverage, you're going to need to have a solution for any days beyond 101. $148.50 is primarily the cost for those folks that make anywhere between $88,000 and $176,000 if you are married. The deductible per year is $203, and then 20% of the Medicare approved services are your out-of-pocket, again, if you only retain original Medicare. Really the focus of today's discussion is to provide solutions that filling those gaps so that you have better options as you utilize the plans. Here's a chart that talks about the Part B cost. Starting with an individual that is filing as an individual that makes $88,000 or less, or if you're filing joint, 176,000 or less, your monthly for the Part B is $148.50. Now again, these are rates for 2021. If you make between $88,000 and $111,000 as a single tax return filer, or if you are married joint and make $176,000 up to $222,000, your monthly for the Part B is $207.90, and respectively. If you make between $111,000 and $138,000 as a single tax file, or joint $222,000 to $276,000, then your monthly for that Part B is $297. So one of the conversations that I will ask when I speak to you one-on-one will be, what income that you fall under, and everything that is under income, including IRA accounts, including pensions, is going to give you the total of what income bracket you fall in, so that we know what that monthly for the Part B is going to be. So here we are going to talk about the two options to fill in those gaps, Med Supp and the Part B. Today's discussion is geared primarily to Med Supp, but we're going to generally talk about the Part C, which are also referred to as Advantage plans. The Part C plans are approved carriers that administer your original Medicare benefits. In California, we have 14 approved carriers, a combination of HMOs and PPOs depending on the county that you reside, and it varies per state. You're also assigned a primary care provider who is your gatekeeper, usually kind of like your quarterback. He or she will refer you to other specialists as your need arises. Most of these plans include built-in prescription drug plans. It also has extra benefits such as gym, acupuncture, dental, vision, transportation, hearing, home-delivered meals, over-the-counter allowance, a Fitbit, an emergency response system, etc., etc. A lot of extra benefits under Advantage plans, but one of the things that I'm excited about is please ask me about the new 2022 Part B give back plans. Those details will be available after coming this Friday, October 15th, 2021. And what that is these plans are designed to provide you money back from the income from the $148.50 that most people normally pay for the Part B. Again, do inquire within, and would be more than happy to give you those details come Friday the 15th. Then we have the Part D plans, also referred to as PDP plans. You have a variety of plans that are available. If your income is above the income limits, as in the example of $88,000 individually or $176,000 married and filing joint, you will pay an extra amount referred to the Part D IRMA. You also will have a 31% penalty times 3306. This is utilizing the base premium of the beneficiary amount of $10.25, and that gives us the $10.30 late enrollment penalty for 2021, again, if you have enrolled late in these respective plans. In a supplemental plan, you will need to add a PDP, also referred to as a Part D. In an Advantage plan, referred to as an MAPD, it would automatically include a Part D. So again, these are different ways of adding the prescription drug plan onto your Med Supp or Advantage plans. Now we move on to enrollment periods. This is really important. Your initial enrollment period is a 7-month enrollment period. It usually begins 3 months prior to the beneficiary's first entitlement for Part A and B, their birth month being the 4th month and 3 months after. Then you have the annual election period for 2021, which is October 15th through December 7th of 2021. Once you make your selection, you will be locked in for the year. Medicare open enrollment period starts January 1st through March 31st, 2022. The MA plan members can switch from MA plans back to original Medicare. It often happens, and so it's really important to stay in touch with those folks that you've helped through the AEP period. And then lastly, we have the special enrollment period, SEP. It's granted when you have a qualifying event such as moving, loss of coverage, or if you're aging in, or if you have a disability and have been disabled for a minimum of 24 months. Again, those are, to name a few, some SEP enrollment periods. The other important topic is when you are parting from an employer plan that has more than 20 lives. If you're an employer under 20 lives, or you're on COBRA, or you are a retiree, you no longer fall in the category of a large group, so you are relegated to apply for your Part B to be eligible and have both A and B. It is recommended that you apply at a minimum of 8 months prior to your birth month. If you leave an employer plan after the age of 65, there are specific forms through Social Security that you need to complete. Please make sure that you jot down these two forms. The first form is CMS L564, and the second form, CMS 40B. These forms, the L564 has to be signed by your employer, and the CMS 40B would be for yourself and any dependent that you had through that employer group plan. There is a 10% per year penalty on Part B if you enrolled after 8 months from when you last worked. There is a 12% per year penalty on the Part D if you enrolled after 63 days or more from when you last work. So those are the kind of the basic rules when you are parting from an employer group plan of 20 lives or more. Now we move on to the Med Supp, also referred to as Medigaps. What are those like? They're usually sold by private insurance companies. They're designed to cover the gaps in Medicare Parts both A and B, also referred to as Medigap. You have 10 standardized plans that allow for easy comparison. Massachusetts, Minnesota, and Wisconsin have different plan designs, and they are regulated by the state and federal agencies. We're also going to talk about plans F and G that are also offered as high deductible plans by some insurance companies in some states. Plans K and L, after you meet your out-of-pocket year limit and your yearly Part B deductible, the Medigap plan pays 100% of the covered services for the rest of the calendar year. Please take note, there is a big difference in benefit coverage when we look at a high deductible plan. Please ask me specifically to note those differences if you have questions pertaining to that. Plan N pays 100% of the Part B coinsurance, except for a copayment up to $20 for some office visits and up to $50 copay for emergency room visits that don't result into an admission. Here's the slide that talks about the different coverages of those 10 respective plans that are available. Typically, for folks that were born after January 1st of 2020, they are going to be eligible for the Plan G. Plan G is the higher end of the plans. The asterisk on this slide is referring to Plan G also has a high deductible plan. I will show you the difference between one and the other so that you understand the difference. Plan F is the higher end plan that's above Plan G, and it's usually available for folks that turn 65 prior to January 1st of 2020. Medigap plans after January 1st of 2020, Plan G, high deductible. Here's an example. If someone wants a high deductible plan, they have an out-of-pocket limit to meet of $23.70. We have a 65-year-old female in Newport Beach, and here it gives you an overview of the cost of the Plan G high deductible, which is $48.26. The carrier is Mutual of Omaha, and the regular plan, which is usually the regular plan that I recommend, is pricing at $152.56 under United Healthcare. So there lies the difference between a high deductible versus a regular plan. What that means is with a high deductible plan, you have to meet that $23.70 before benefits begin. So in the long run, it's my opinion that you end up paying more for those types of plans. A high deductible Plan G requires that you have both Medicare A and B because they pay the first 80%. The remaining balance is paid by the plan member until the expense reaches that $23.70. In the example of a doctor visit, Medicare approved amount is $100. Medicare pays $80, leaving the client with the 20%, which is $20, which is an amount that you would pay, and that amount is applied to that $23.70. If a member is hospitalized and Medicare pays for hospitalization minus the Part A deductible of $1,484, that is applied to your $23.70. So again, the high deductible Plan G, you're pretty much paying everything up front until you've met that $23.70 before the plan pays the rest at 100%. In some, a Supp Medigap plan is a secondary payer to Medicare. It also is guaranteed renewable. That means that once you are on a Medigap or a Supp plan and you've enrolled in your initial enrollment period, you are guaranteed issue. They cannot cancel you. The only way to get canceled if you fail to pay your premiums. You have the freedom to see any provider facilities that accept Medicare. About 95% of all physicians and 98% of all facilities contract with Medicare and Supp plans. Clients can enroll anytime during open enrollment. If they are guaranteed issue, meaning there's no underwriting, open enrollment, and guaranteed issue is when you age in to 65 in your first year. That is when you are guaranteed issue and you're not subject to those underwriting questions. The ones that are underwritten, if your first year of eligibility has passed, then you will be underwritten. And really the key thing is, as long as you haven't been hospitalized within the first 90 days, most of the time you will be able to qualify, possibly with a rate up in that respective plan. And clients must purchase separate Medicare Part D to have the prescription coverage as well with a supplemental plan. Supp plans, clients pay a premium. The premiums usually change slightly annually depending on the carrier. The better the coverage, the higher the premium. Obviously, Plan F is the highest premium, but most folks that are on Plan F, if they are 65 prior to January 1st of 2020, they are paying everything at 100%. Plan G does the same exact thing. The only difference is that Plan G has a $203 deductible if you have an outpatient or an inpatient hospitalization. And Plan K, if available, is generally the lowest premium option. So that is something that we would need to check depending on the state that we are looking at. Why are Supp plans better? Well, again, you're fully insured. You have guaranteed renewable. The rate increase is annually, but it's very important to look at carriers that have a pretty stable rate long term. And I will make those recommendations when I meet with you one-on-one. Any provider facility that accepts Medicare, again, Supp plans, your network is going to be larger than under an Advantage plan. You have unrestricted enrollment. The underwriting, if you're not in that first year, you're subject to the underwriting, but the guidelines are pretty, most people qualify unless they've been hospitalized, or if they don't have any major conditions, they'll more than likely be able to qualify. Again, and you do have to add a separate Part D, and they are federally and state regulated. So we're going to look at some case studies. Here we have Matt. He lives in Seattle, Washington. He's 68. He retired from his job and is dealing with a chronic condition that has him visit his doctors on a regular basis. He was also advised that he's going to need a specialized surgery in the future, and the doctor recommends that he go to Mayo Clinic to have this done. He signed up with Aetna, Plan F, a rated A carrier with a stable rate history that allows him to use those benefits at the Mayo Clinic when that time comes. Again, he chose Aetna because that's what he had when he had group insurance through his employer. Here's another case study. We have Kurt from Nashville, Tennessee, 63 years of age, qualified under Medicare due to a disability. Again, in order to qualify for a disability, you would have had to have been disabled for a minimum of 24 months. He is being treated for pain management and regular visits to the doctor. He fears that he will need help of a wheelchair in the future and may need to move to an assisted living facility. He lives on a fixed budget through his Social Security benefits and his 401k, and thereby can't afford any surprises. So again, a supplemental plan is a good fit because it gives you the exact rate times 12, and most of the plans, if we're looking at a Plan G, is going to have zero out of pocket with exception of the $203 deductible. The rates are the same as someone who's 65 that have averaged 2.1% increases since 2013. Again, this we're talking about in the state of Tennessee. In the state of California, as a side note, if you are under 65, your rate starts at $317. So again, it does vary by the state. The next case study is Kate, who lives in Newport Beach. She is 65, has a lung disorder, sees a specialist in Orange County and LA County at UCLA Medical Center. Her doctors do not accept HMOs, so wants the freedom to access her doctors without a referral. She signed up to AARP UHC Plan G, added the Affordable Plan D, and likes knowing that her monthly costs are fixed and reasonable and will not be billed copays or coinsurance. She travels to various states and is able to access doctors across the U.S. So again, the flexibility and the portability of a supplemental plan is usually what's attractive about Supp plans. More importantly, because you have the control as opposed to the insurance company having to have you wait for those referrals. And in closing, think of Medicare Supp when the client doesn't want to pay copays or coinsurance. The client doesn't like the idea of a network, or the client cannot afford a surprise $1,500 and plus hospital copay. Here is a short list of carriers that I contract with: United Healthcare, SCAN, Blue Shield of California, Anthem, Cigna, HealthNet, Mutual of Omaha, and Humana. Next step is to schedule an appointment with me. I have two corporate offices, one in Newport Beach and my main office in Upland in Inland Empire. You can also email me direct. I do respond to emails within an hour. I check emails between 4 and 6 in the morning and 6 and 8 p.m. The other preferred mode of contact is my cell, area code 626-497-6640. And kindly visit my website. I will have all the events and webinars that I have coming up over the next couple months. It will have those posted starting tomorrow. And I look forward to speaking to each one of you that have joined. I want to thank everyone for taking the time. Again, here are my respective contact numbers. When I meet with you face to face, I do temperature checks just to be COVID compliant and to stay safe, and I do keep the social distance guidelines. However, I also do Zoom meetings available in all 4 counties: Orange County, LA, San Bernardino, and Riverside County. I do not see clients by walking. I only see clients by appointments only. So do reach out, and I look forward to meeting each one of you. And now we're going to move on to questions. So let's look at the questions that we have. Medicare Part B premium, is income gross or net? It's gross. They look at your gross income. Next question, can I move around insurance companies that offer the same supplemental plan without them being underwritten? Absolutely. Once you are on a supplemental plan, for instance, if your rate increases with one carrier, we can move you and it would be seen as a lateral move with a different carrier to offset those costs. So those are the 2 questions that we have. I am hoping that if you have any other questions, please jot them down in the chat box. If not, thank you for joining us, and I look forward to speaking to each one of you. We are going to have a great AEP this year. It starts Friday. Very important. Otherwise, I look forward to meeting you. Thank you.